So good morning and welcome. Thank you for joining us. Today we are going to be talking about the science of CBD dosing. We have a full panel of experts for you today with Kathy Ecker, Rena Caven.
She can't hear.
I'm sorry. We have Kathy Ecker, Rena Caven, Joe Wicker, and Steve Clearly here with us today. My name is Jasmine Oliver. I joined the industry back in 2017. I quickly noticed there was a huge lack of education, quality standards, and overall safety for employees. So I founded Cannabis Science Consultants to close those gaps and elevate the standards of our industry so that some of these stigmas can start to be pushed away with education as we continue to research. I served as the subject matter expert in cannabis for Doane University and educated close to 20,000 students. Besides that, I'm also the Western Regional Director and Chair for CBDIA, and I sit on the advisory board for the Cannabinoid Medical Studies. So, if you want to start.
Okay, hello, can you hear me? Okay, my name is Rena Caven, and I am CEO and co-founder of a retail store called Tribe CBD and Cannabinoids in Austin, Texas. We have 2 stores currently and are expanding. What we are is basically an education center as well as a retail store where we curate other brands. We're not our own brand. We bring together all the wonderful brands out there that we can thoroughly vet, all original products, no white labels. Everything is researched top to bottom. We know the makers individually, and so we're really proud of that. I've been in cannabis business for about 7 years. I have a wellness studio also where we do massage, acupuncture, and skincare, where I originally discovered CBD. I've been working with it. I'm a former attorney, so I'm fascinated with the legal aspects of it. I'm also a total nerd, so I really get into the science of it. So if anybody wants to talk to me in the next 2 days about anything and everything cannabis, I love it. I will nerd out on you and talk your ear off. So that's me.
Hi, my name is Joe Wicker. I'm with a company called Botanic Wellness. I'm the executive vice president and also an executive director. We are a company that's being listed on the Australian Stock Exchange as an Australian IPO. We farm hemp here in the US and in New South Wales, Australia. We farm here in Texas, Arizona, and Colorado. We make our own products all the way to white label and finished goods. What I bring to the conversation here is just we have product on the ground in Australia, product on the ground in the UK and in the EU. And so I have a bit of a different perspective, getting to see how it's handled internationally and how the different governments are looking at CBD.
My name is Steve Cleary. I'm the founder and CEO of a company called Sleep Cream. So as you can imagine, I'm laser focused on CBD topical for sleep. I think a lot of people slept in this morning. I don't see them. But we've learned a lot about dosing because we've learned that what works for somebody, will not work for somebody else. And through our studies, we found that a lot of the studies that were being cited used CBDs in much, much greater amounts than we typically see in a store, in a retail store. And so where somebody may use 15 milligrams or 30 milligrams a day, we found we needed to work with customers that needed 100 to 200 milligrams a day to have the appropriate effect. And so our focus is on a topical and delivering through the central nervous system. And it's part of my own journey, which we don't have a lot of time to share here, but CBD literally saved my life. I had a massive heart attack a year ago, and if I hadn't changed my health patterns, I never would have survived. So I'm here as an advocate, as a user, as a believer in that CBD can really help in the proper dosages with sleep.
Hi, I'm Kathy Etker. I am president and founder of Colorado CBD Warehouse. That is my retail business. I also have another business called Beneficial Shop. It is for 501(c)(3)s, nonprofits, mainly dog rescues and veteran groups. My passions are dogs, obviously, and veterans. And I honestly like most dogs better than most people. And that's what got me into the CBD world. I wanted to get myself off of Zoloft for 20 years, and I wanted to help my 12-year-old yellow lab that her hips were going out. And also rescue dogs. I don't know if anybody knows anything about rescue dogs, but they are so scared and so broken. And gosh, I swear to God, it's changed some of their lives. The CBD has just helped them become real dogs. They don't know how to be a dog. So that's my world. Thank you.
Thanks, guys. As you all know, cannabis is an incredible natural resource, and there's actually, can't you hear me?
We're having trouble here.
What about now?
A little better.
I'm really close to this thing, I might spit on it.
It
All right. Cannabis is an exceptionally natural resource with evidence of over 25,000 applications in history, ranging from textiles to food to medicine and much more. Our knowledge of cannabis, unfortunately, has been greatly, significantly impacted due to prohibition, as you guys know. Nearly 100 years of being unable in this country to study the plant formally. So as a young industry, there's still a lot of gray area that we have to learn and explore. You guys can find CBD products anywhere these days. Grocery stores, the gas station, even my hair lady has a line in her salon, and I will get you her info if you want it. So anyways, without further ado, let's jump into some questions. When it comes to CBD dosing, can you please explain some of the variables that should be considered by the consumer?
Couldn't hear it at all. I'm sorry.
Can anyone hear me?
Yeah. So, what you had asked about was CBD dosing and the variables, and so I'll start with. I have some experience, and our products have been approved through the medical access scheme in Australia. Meaning we had to get approved through the TGA, and the TGA there has some overlapping duties as the FDA does here. So, in doing that, we had to get review of what is dosing, what are the dosing procedures for that approval. So Australia takes a very different attitude in looking at it from a medical aspect, whereas here in the U.S. it seems to be they're trying to squash what they call false claims and stuff like that. Everything in Australia is done, and through the TGA is done through clinical trials and looking at actual data. So they've come up with some definitions for what they call a low dose, a high dose, and a medium dose in dosing. And so a low dose, by the definition from the 2020 TGA report, is 1 milligram of CBD per 1 kilogram of body weight, 0 to 1 milligram per body weight. So basically, what that means for those of us who don't weigh ourselves in kilograms is that roughly the rule of thumb I would use is, since I'm a 200-pound man, I would use 100 milligrams of CBD orally, and that would be still considered a low dose per day. And then a medium dose, by their definition, would be 1 milligram to 10 milligrams per day per 1 kilogram of body weight. So now we're looking at anywhere from 100 to 1,000 milligrams a day would be a medium dose, and for a high dose would be anything from 10 milligrams to 50 milligrams. Those are the categories that are used. And I think what you'll find as you're walking the floor here, almost all of the products that are designed for consumer use they're in the low dose category. So they're relatively safe. They don't have a lot of side effects, and it's easy for the consumer to take and not have any issues with. And I think if you're going to move to a high dose or a medium dose, you really should be doing that under a doctor's supervision. And the main reason is because you're trying to interrupt something that's going on. And so when you're trying to interrupt something that's going on in your body, you're going to want to do that under a doctor's supervision.
I'd just like to add, I'm really glad that different companies are putting together these tables of small, medium, high dosages guidelines, but it's so very personal, the right dose for each person, and there's so many factors that come into play. What I see from the consumer side is, obviously one person will take one product and need 20 milligrams. The next person takes the same product, needs 100 or more. Obviously, the factors of what's in the product, is it full spectrum? Is it an isolate? Full spectrum tends to be more effective than an isolate because of the entourage effect. It has all these cannabinoids and terpenes and flavonoids. What are the terpenes in that profile? If it's got myrcene in it, it's going to make you sleepier, it's going to affect you differently. If you have a sensitivity toward THC in a full spectrum product, or one of the terpenes or flavonoids, which people do, then that can change the effect. So you may want to up and down your dosage. What the hardest part for people to do is really be patient in finding out their right dosage. I have been in the business long enough to know that I don't start people out on one drop. I think that you can do that. It's going to take you a long time. But you really do have to measure, what you're taking it for, how it's affecting you at that moment, before, after, chart these things. It's important. If you've got one product that is even extracted a different way, that makes a difference. If it's a heat-pressed rosin versus a CO2 extracted product, you're going to have lost some of the terpenes, some of the cannabinoids. It's going to change the way it acts in your body. So there's so many factors, and we can go into all of those. I'll let other people speak, but so many factors: metabolism, genetics, everything that can affect finding the right dose for you.
I'm going to piggyback on a little bit of what Rena just said, and I personally agree with everything she just said. I do not have any science. I don't have any scientific reasons for what I tell people to take. I start them out with a small amount, 4 or 5. I love oil. I love sublingual oil. That's my go-to product. And in my world, dealing with dogs and veterans, with veterans, you're dealing with so much. You've got PTSD, you've got pain, anxiety. There's so many problems that I usually start those guys off a little bit higher, 5 to 10 drops twice a day. But it's the same as what Rena said. Your body's going to be different than mine. Everybody's is going to be different, and you have to be cognitive of your body, which a lot of people aren't, but you're going to know what works for you. If you think it doesn't work, I've had so many people tell me, oh gosh, this didn't do anything. Okay, first of all, are you being consistent? Are you taking it consistently? And second, up your dose if it's not working. Don't think it's going to hurt you. You can take that whole bottle. It might make you drowsy, but that's about the worst thing that's going to happen to you. And I strongly, strongly suggest, especially for the dogs and the veterans, THC, full spectrum. 0.03% THC in any product isn't going to hurt you. You're not going to get high. You're not going to be doing an LSD trip, which in my world, in my age world, some people still feel that way. CBD is a gateway drug to some people still. So that I agree, Rena. Good.
Yeah,
Good
I always advocate for full spectrum if possible, but a lot of people do have THC sensitivities.
Oh, I agree.
Yeah, it can make your heart palpitate. It can have the adverse effect of the CBD, and you don't.
Especially with heart. I have a friend that has heart problems.
Yeah.
And she can't take, so I give her the.
Absolutely, and there are studies out there that show some parts of the population have a higher tolerance for THC, and also if you're a THC user and you have a tolerance built up, a full spectrum product is going to affect you differently than it might somebody who is cannabis naive. I think it's interesting, all these different aspects that come to play. It is very personal, but I think that full spectrum isolate difference is really, really key. And also, if you're looking at something like sleep or anxiety, where your serotonin receptors are receiving the CBD, you need a higher dose to get those working. So a lot of people don't know, for pain, you may need a little bit less than you need for a stress or anxiety. For PTSD, your milligrams can go very high. So are you smoking it? Are you taking a sublingual tincture? Are you using a cream, for example? All of these things affect the doses.
Yeah, so I agree with what you're saying in that you'll definitely want to start on a minimal dosage to begin with, and then move up from there. And if you're using CBD to treat anything, it's important to remember that CBD is an add-on therapy. It's not a replacement therapy for anything else that you're doing. So that's the way it should be treated. And then the thing that hasn't really been addressed, and this is maybe something that you would want to speak to as well, which is, yes, everybody has a personal, individual response to CBD, but it also matters how you're taking it, and that's how that response is gonna hit you. As an example, we have gel caps that we use. Now, when you take a gel cap, it's going to go into your body, and first you have to dissolve the gel cap before it goes into your digestive system. That's very different than smoking something, and you're going to get a total different reaction whenever you're taking a topical, as it like you're used to doing. Topicals are going to hit you within the first 15 minutes, but the percentage of CBD that's going to make it through the skin is about 64% versus going through your digestive system, or even breaking the blood-brain barrier by taking it under your tongue or by smoking it. So these are all things, not only what type of CBD you're taking is important, but how you're taking it is going to affect your experience. And so a 100 milligram dose of a topical is not equal to a 100 milligram dose through your digestive system.
Yeah, I would definitely agree with that. One thing we find is that people, we give them the topical and then they put like a little tiny bit, right? And it's like they're afraid of it. And maybe I've worked too much in the Christian marketplace, but they're scared to death of it. And it's like, you tell them, so I started telling people to take a bath in it, not literally, but put enough on to really get the experience. Because we find the biggest challenge we have is people not using enough. And when you're quoting statistics from Australia, and you're saying 100, 200, 300 milligrams a day, and you walk through retail stores and you walk through C-stores in the States, and those are 10, 20 milligrams a day, and then you try it and you go, well, it didn't really work for me. Mm-hmm. And I hear that a lot. Oh, I've tried CBD and it didn't work. So especially with PTSD, we're telling people I use 200 milligrams a day, and that's what I need to, and it helps me sleep. And I didn't sleep for 12 years before I started using the product. And so we tend to take an approach. You've heard start low, grow slow. We start, use as much as you can. Put it on, put 100 milligrams on. They said, what's the side effects? And I said, well, hopefully sleep. But the worst thing that's going to happen with a topical is you're going to wake up groggy the next morning. But then you know it works. Then you can back off from it. So with the topical, and I think it's a lot safer, and I would not advocate this for an edible or something you ingest, but for a topical, encourage people or try it yourself. Try using more. In the worst case scenario, when it comes to sleep, is you're just going to be groggy, or when it comes to pain, you're just going to feel a little too relaxed. But there's no negative side effects that we have discovered with a topical. So we encourage people to push those limits a little bit, not be so afraid of it, because it's not going through your bloodstream, it's not going through your liver, and 64% of it is going through your central nervous system, and hopefully it's just there to provide some relief from anxiety, restlessness, and stress.
Yeah, I think that, I'm sorry if I'm jumping on you, but it's what we're all looking for is homeostasis, right? We're trying to find that balance with whatever product we're using. You can reach that balance and then decide that that's all you need. One thing about CBD that is very important is that it's biphasic or triphasic sometimes, in that there is a curve. You can reach a point where you find homeostasis, where you find the right balance for your endocannabinoid deficiency. When you go over that, it's not sometimes that you just get sleepy, which is what a lot of people think. It can have the opposite effect. CBD has been, it causes alertness in small doses, so that's why you do need a little bit more for sleep. But the biphasic and the triphasic these bell curves of how it affects you are very important. And again, it's an individual thing, but we know that it's true. So, if I'm taking it for PTSD, I can take a certain strain at a certain range and find my sweet spot. I take a little more, it can make me manic. I mean, there are side effects to taking too much. There aren't, it's not going to cause you death, it's not going to, maim you, it's not going to cause liver damage, as all of these people, some of these people have said out in articles, various articles. There was that Forbes article a while ago that was just miseducation about how CBD affects the liver, but it can have some opposite effects, and a lot of people don't know that. So the go slow, start low and go slow is a great way to do it. You may not have to start at 1 or 2 drops, but some people are certainly really sensitive to it. So 5 milligrams is enough. Not for me, but that'll work for them depending on the product. So I wish we could all sit here and say, yeah, there's one great dose, and I really hate when I go into stores and they say, just take a dropper full. It's like, well, how big is the bottle? How many milligrams are in the bottle? These are things that consumers have to look at, and to be truly educated and to be able to share that information is key for helping them find that homeostasis.
So one of the things that you mentioned that I think is worth noting is that CBD does have an effect, what they call like a grapefruit effect on your body and on your medication. So there are some medications that it will enhance, and there's some that it will actually diminish. So if you're taking any medications, it's something to be in consideration with. And then how you take it also affects which of your CB1 or CB2 receptors it's going to go through. So one is through your organs and the vessels in your body that way, and others through your neurological system. And so that could also account for some of the different experiences people are having depending on how they take it. And I'll give you something to try for yourself, which is you could take a tincture, like we have tinctures. You could take a tincture and put it on your tongue one day and see how that feels. And then the next day, literally lay down and rub it right on your belly button. Because there's about 70,000 veins that come together near where your umbilical cord was. And you may notice that there's a different experience from the same product, whether you put it on yourself topically in a spot that can be absorbed through your entire system, or you take it orally. So it's something to try, something to play with, and I think you'll be surprised at the difference the same product, the same dose will do for you each way.
We're going to do that at the end. Sorry. We're going to do questions at the end, sorry. Okay, thanks guys. Can you talk about bioavailability, absorption, and drug interactions and why that matters a little bit more?
Well, you just spoke, Joe, about the grapefruit effect, and that's one of the key drug interactions that has been discovered. That basically, if you can't eat grapefruit, don't take CBD. It's a vasodilator, so it has wonderful effects when you're looking for like an intimate serum. But if you're on a blood thinner, it's not as exciting. So that's important. Bioavailability is everything. I mean, it really depends on, again, who you are. I hate to keep repeating this, but it's very individual, right? I'm sure there's lots of people that have comments, and I certainly don't want to hog the mic, so I'm going to go ahead and let you guys.
I'll speak to it quickly, which as far as bioavailability, so we touched on it before. How you take it matters. So whenever you take it topically, it's going to be in your system probably within 15 minutes. You take something like a gel cap, it's going to take about 45 minutes before that breaks down and gets into your digestive system. And if you use a water soluble, that'll be processed through the liver, and that'll also be about 15 to 20 minutes, almost like if you were drinking an alcoholic beverage kind of a thing that's processed that way. So the delivery system is probably the biggest impact of bioavailability, and can cause, frankly, if you're not thinking from there, it could cause confusion where I take 100 milligrams going through my digestive system and don't feel it the same way I feel it whenever I put on his cream. Then in the same amount of time, I think I didn't take enough. when I'll actually feel it probably an hour later is the difference.
We find that the bioavailability, which is obviously a big topic, with the topical, we find where you apply it obviously makes a difference. When I first started using it, I was using it on my temples and my forehead, and when I started using more, I just was running out of room to apply it. And somebody said, like the essential oils, put it on your feet, and it just didn't make kind of logical sense to my brain. Put something on my feet to help me sleep. I was trying to get it as close to my brain as possible, but not really understanding the science of the central nervous system. And the feet are absolutely the best place to apply topical, and it makes it very effective. And we usually see results in 10 minutes, and so it's that fast with the topical. But I also encourage people to put it on your hands. Sometimes if somebody has pain, they put it on the place of pain at night to sleep, and they might put it on their knees, they may put it on their back, and it'll still work. But the more sensitive the skin area, and the more nerve endings you hit, the faster it's going to work. And the only thing I want to add to that is, I don't know if there's still a lot on the market, but there used to be topicals on the market that have a driver that would drive it through your skin layers into your bloodstream. And just know that we do not use drivers. Just know, are you using CBD in your nervous system or in your bloodstream, or a combination of both, which can be very effective. But if that topical has a DSMO driver, it's basically an alcohol that's driving it into your bloodstream, or a patch. If you're wearing a patch, it may feel like a topical, but it's actually driving it into your bloodstream. And so I think to know which topical you're using and what it's meant, we're after the second dermis skin layer, and that's where we're hitting the nerve endings, and we find it very, very efficient delivery.
I agree with what has been said. One of the places I've had customers tell me is the wrist. I have not ever tried that, but they say it's really quick to get into your system.
Do you want to try some?
But
Bring some feet up here, please.
The first thing I tell people is know what you're buying and know who you're buying it from. Don't go to Costco. Don't go to King Soopers unless you know what you want and know what you're doing. But everything that's said, I agree with.
Yeah, and CBD is an oily molecule, so it looks for places to bind with fat, right? So you'll have a better bioavailability if you take your CBD with a fatty oil or some sort of fat. So you're going to have more absorption if you take CBD with a full stomach. It seems almost counterintuitive, but it's true. And that if you have a little more body fat, it can bind in there and sometimes last longer. And they say the absorption, the bioavailability is better in people with a little higher body fat.
Thanks, guys. So next, I just wanted to talk a little bit about labeling. So as we know, there's really no standards for labeling, and some packages will only have what the entire container has. So if you go and buy a 1,000 milligram tincture, for example, how do you know what to take for just one dose? Did you hear any of that?
Part of it. It's partly me.
Okay.
How much do you take?
Yeah, so if the label only has the entire amount of CBD listed, how would you figure out what you would need for one dose?
Math. Yeah. Well, you've got usually your bottles are in milliliters, right? So a standard bottle is going to be 30 milliliters per bottle, and then you'll have your milligrams if it's a 300 milligram. If it's say for example, a 1,500 milligram bottle, you're going to get 50 milligrams in a full dropper from a 30 milliliter bottle. So it's really math, it's division, and oftentimes when you're purchasing it, the retailer can help you with that. There are sorts of CBD calculators that you can use too, but it is simple division, and the point is to know that you're starting with the right milligrams, whatever the bottle says. People are still confused. They see a 1,000 milligram bottle and they think it's 1,000 milligrams per dose. God help you, I don't think you need that much, but yeah. And then you look at, not to bring in a totally different topic, but here it goes. Delta 8, which is actually, degraded CBD, that dosage is entirely different as well. So I don't want to ramble on that, but If you have any questions about it, I love to talk about D8 too.
So, as far as labeling goes, one thing that's like really simple, if you're going to take something like a gel cap, like as an example, or just a straight 25 milligram per gel cap. So that's simple to understand and see, and you can see how many you're taking. Same thing with many of the gummies that are here on the floor, how many milligrams per. But I think where the confusion comes in is with the tinctures, and one of the problems that's happening on the floor here today is they'll be labeled in milligrams per bottle, and the bottle sizes vary. So you'll have a 4,000 milligram bottle and a 30 milligram or 30 milliliter, 4,000 milligrams of CBD in 30 milliliters or 60 milliliters. So whenever you're a consumer, and that's the thing that seems to be really missing, is that we talk to each other so much that we think that the consumers are really that concerned about the minute details that we are fascinated by. They just want to know, look at the back of the bottle and say, how many do I pop in my mouth? So one of the things that is happening in the UK with the novel foods applications and also in the EU is almost all the tinctures are being moved to a percentage basis. So I have a 15 milliliter tincture that now somebody can pick up right next to my 30 milliliter tincture, and they're not both labeled 4,000 milligrams, they're both labeled 20%. So they know both bottles, same dosage no matter what size I get, and that's something that I think is really missing here right now in the U.S. is the clarity on the oils, so that you know exactly how much to take. And there really could be, since there's CBD in the topicals as well. One of the things that we do is we use a pump, so that way you know what a serving, how much each pump is going to be. But if you don't do that and you're just squirting it out of the bottle like a tube of toothpaste, the consumer doesn't really know what they're getting there either, other than how much they're squirting into their hand, which is kind of difficult. So, yeah.
That's exactly why we went to a pump dispenser, and because there was a lot of confusion, and of course milliliters, milligrams being volume versus weight. And we wanted to simplify it, so now we say, one pump is 17 milligrams or 16.7 milligrams of this product. So it's really easy for someone to do the math, and we may say, try 4 pumps, then go 6, then go 8, or just depress it so many times. And so I think the U.S. has had a lot of confusion over the actual dosages, but I think we're getting a lot better, and I think people are understanding it better. And we used to use a jar, and we'd say 3 or 4 dabs, and what's the definition of a dab? You couldn't really define it. So
Is that like a pinch of salt?
Yeah, a pinch of salt. So I went to the airless pumps, and it really helped. And it's easier for us to give advice on people on what to try because the math gets real simple.
Once again, know what you're buying and know who you're buying it from. That's my suggestion.
Thank you, everyone. So I just have one more question before I open up to the audience. Can you please suggest some common conditions and the CBD doses that are required to address them?
Can you say that again?
Can you guys suggest some common conditions and the CBD doses required to address them?
Well, I think I started to mention earlier that, anxiety and sleep, they're hitting your 5-HT APT1 receptor, and that's your serotonin receptor, right? So you're going to need a lot more than you might need for something else. There's also microdosing, which is, I think, an important topic in relation to dosing, and that works great for a lot of different ailments, depending on the person as well. I think for pain, it hits your TRP receptors. That you may not need as much, but again, individualized. I know if you're dealing with MS, we have a lot of clients with MS, autism, and they look for higher doses. So those are definitely higher dose. PTSD, oftentimes if it's an immediate, chronic issue or an acute issue is a big deal. If it's an acute either anxiety attack or pain attack, you're going to want to probably try smoking. It's the fastest way to get it into your bloodstream, and it can calm you down immediately. if it's, if you just have mild anxiety, maybe a 10 milligram mint or something can help pass that acute issue. If it's chronic, generally you need more, and you need to do it on a regular basis. I think there was some discussion about keeping up with your dosages. I take it daily. I have found my sweet spot, and I take that daily. I often microdose. If it's been a day and a half, you take a little bit more. But for pain, you're putting on a topical, and maybe you're taking a formulated CBD product for pain. You may not need as much. For sleep, generally you need more because of, again, the serotonin receptors.
Yeah. So to start, repeat something I said earlier. So CBD is should be used as an add-on therapy. So if if you have pain, it's not, or some of these other disorders, it should be used as an add-on to your other therapies. And having said that, it has been proved effective in almost everything that there's clinical studies that back up almost everything that she just said, as far as anxiety, chronic pain, inflammation, seizures, MS, PTSD. It does create homeostasis in the body. It's a support to your immune system, helps you balance things out that the body is not able to balance out on its own. And so most of our anecdotal evidence has come from people who are using some sort of therapy. They add the CBD, and suddenly it's effective. And that seems to be the biggest use for our company.
Yeah, some of those formulations can be really helpful too. If you're adding different herbs or adaptogens as well, that's going to change the dosage that you might need for that particular thing. If you're using it for pain and it's got capsaicin, MSM, arnica, and these other things in the formulation, you may not need as much. Again, if you're doing an isolate product versus a full spectrum, if you're using isolate, you're going to need more. So whether you're taking it for pain or anxiety or any of those things, you're going to need more of that because of the entourage effect and all the other cannabinoids and terpenes that have those medicinal properties.
I think the best news in the industry is that the cost of the raw materials has come down dramatically. The first time I bought a kilo of CBD isolate, I had to spend $9,000, and so obviously it drives up the price of the product. The last time I bought it, I paid $500. So what I appreciate is we're able to put more CBD in the container for the people who need it. And when you're dealing with people that are breast cancer survivors, suffered with PTSD, suffer from pain, the good news is that they can try higher and higher dosages within a topical safely. Obviously, we recommend physician supervision anytime you start increasing those dosages. But you get people, the pharmaceutical, using 1,000 milligrams a day or more on children. And that's the one approved drug. I mean, you think about it, 1,000 milligrams in one day, that's what they're, plus some of them up to 2,000 milligrams a day. Now there's been some studies with liver damage or increase in liver enzymes because of that, so you obviously want to be careful. But with the topical, we want to see how much CBD we can put, because they can always just use dispense the pump once and make it last longer, or if they need it, they can dispense it many, 8 or 10 times. And we have found the number of people that we're able to help has gone up exponentially by being able to provide higher dosages, and I think the industry is moving in that direction. But the only reason we can afford to do that is because the price of the CBD is going down. We're working now with testing with Equine facility, and we're making 8,000 milligram containers. And so the dosages keep just going up and up and up. But fortunately, the price points of the raw material are low enough that we can do it affordably.
Something that I'd like to add is when I am dealing with the veterans, oftentimes there's so many comorbidities. I mean, they're dealing with the PTSD, the anxiety, all the other problems that come with their world, pain. And oftentimes they have to use more than one product. Maybe they like the gummies. I tell them to use them just as an add-on. Use either an oil, which you're going to be able to control that dosage, or a gel cap. And a gel cap too is good because it's going to take a while, but the gummy is going to help that come along quicker. And it's not going to hurt you to use all of those. I mean, you can take a You can take a gel cap and eat a gummy. And I mean, don't do it all at once, but and use it something on your back, an icy hot or whatever. So, I agree.
Yeah, I think there's a lot of research coming out in Alzheimer's and Parkinson's. We know about THC and dyskinesia and all that stuff. It was really exciting. I think the biggest takeaway from this is that we're still not seeing the research here. If anybody wants to look to the research as to all the things that CBD is good for, look to Israel, Dr. McCullum, and they do some great research and have been doing it for decades, much more cannabis friendly than the United States. So there's a lot of studies as how it relates to cancer and all these things, anxiety, even pain, that we're not supposed to say CBD does good things for, according to the FDA. They've got research studies, and NIH has some great studies to read too. So the biggest problem is until it's federally legalized, we're not going to get the studies that we need to really show how it is effective for all these different ailments. But we have a lot of anecdotal evidence and a lot of small clinical trials that show us that this works great. I wouldn't have put my money and my name and my life into my store if I didn't believe it. And there's enough people in the world that do. So hopefully the United States will get on board and, start studying this a little bit more, and we'll have more information to share.
Well, and also, there's just so many new products. There's so many tests. There's so many things that can help. We're working on a product right now with isolate and, what's what moms produce? Colostrum. Colostrum is doing amazing things with the CBD in equestrian, in horses. So, just wait till tomorrow. There'll be something to help you if we don't have something now.
Yeah, she brings up a good point in that CBD is not only effective in humans, it's effective in other animals like pets. And so just as the considerations we took of how to take it and how much to take should be considered for your pets as well, like where to put it. It could be put on their nape or on their groin, or they could take it through their food. And understanding the effects it has on the pet will be probably different how you do it, just like with a human being.
Oh, exactly. And dogs. I have a Yorkie. If you know Yorkies, they're all neurotic. And he's just a spaz. And I give it to him every morning. And it seems to help him quite a bit.
Thank you, everyone. We're actually running out of time, so does anyone have any questions?
I have not, but that's a really good idea. Well, that's the first question I ever asked someone. I don't have a brick and mortar, but the first question, why do you want it? Just because it's cool, or, are you trying to accomplish something with it? What are you trying to accomplish? And that's going to dictate exactly what you say.
Well, I can tell you as a store owner, I have played around with that idea, but we have really kind of like a living room in our store, and I'm not going to find out on a piece of paper everything I need to know, or it's going to only encourage me to ask more questions. So we just sit down and we talk about it, because most people are coming in still new to CBD, or they've tried products that haven't worked, and so the first thing you want to know is what are you looking to fix here? What are you looking to use this for? What are your sensitivities? Are you on medications? Are you drug tested? Can you handle a full spectrum? Do you have other sensitivities to that? So a lot of formulations have other products in them. Are you sensitive to those? Melatonin, capsaicin, other things. I like that idea, but I find it not very effective when you're dealing consumer to, educating the consumer. It's really a face-to-face. That's most often, and that's how they're going to reveal these little tiny things that might play a role in what you encourage them to take, that they may not get out on a piece of paper. Right. If you can get them to do that, yeah, then great. I think outside of a medical kind of facility, you're going to have a hard time getting people to fill out a form. If they're going in for massage, they're going to fill out a massage intake form, that kind of thing. But when they come into a store and they want to see products, they really probably want to talk to you more than they want to do that. That might be a turnoff for a lot of people. Has he tried Epidiolex? Okay, because Epidiolex is FDA regulated, it has and approved. It has a dosage, basically calculator, and it's very high. So that's what's going to help. You can find different, dyskinesia or muscle spasms, things like that, where CBD in a lower dose than an Epidiolex dose is going to help. But for children, I'm not a doctor, I don't diagnose, and I can't say this is going to be great for your children. And then, there's studies that show THC or a full spectrum product is not necessarily good for the young brain. Once you develop your brain, it's awesome as a neuroprotectant. But for children, I do have several people that come in, especially with COVID, right? And their kids have been super stressed out. There's lots of broad spectrum products where you can give them a micro dose, and they're getting the formulation with the adaptogens and the herbs that have already been shown to be safe for kids. And I just let the parent make that decision. I say, this is what we've got, but a lot of people have found great success with kids. Focus.
So
CBD and THC together have the best. No, I think CBD, THC. The CBD helps the THC be more effective, which is why you don't always need really high doses of THC. So you don't need that high effect. But even a very low dose of THC, that CBD is going to sparkle the goodness in it and help it to work better. Same reverse. So whenever you have both things, it's better. But especially for a child, you don't necessarily want to get them high all the time. But a bit of THC can help them with this. If it's a seizure, a serious seizure problem, then the THC is okay.
So it's one of the faster ways, but obviously you're not going to want to have your child smoking anything. I would assume so. And you definitely can't do that. So topical is also a good way to whenever somebody's having a seizure and they can't get it in their system. So moving backwards a little bit to your question, so it depends on the age of the child. That's a big factor, whether or not they're able to communicate what it is that they're feeling, what they're doing. You'd want to see a pediatrician, especially with something like seizures. See a pediatrician, do it under their supervision, because it could be necessary to, in order to interrupt what's happening, to go beyond what would be typical over-the-counter dosages that you would find here. And you definitely wouldn't want to do that just experimenting on your own. You'd want to be doing that under doctor supervision.
Yeah, and there are syringes and things where you could do the sublingual, which is, you're not going to give a joint to a kid having a seizure, but if you can get a little bit under the tongue, that's the second fastest way it should be, and that's what they're using in a lot of the Epidiolex situations is a concentrated dose.
Okay, thank you so much, everybody. We're actually over time, so that concludes this panel. I really appreciate you guys joining, and I hope you learned something.